Hi, my name is Dr. Megan Wiley. I am a physical therapist at Balance Within Integrative PT, and I get a lot of questions about pelvic organ prolapse. What is it? What can I do about it? When is surgery needed? And is PT helpful? So I want to answer some of those questions today. So what is a pelvic organ prolapse? A pelvic organ prolapse is when you have the tissues and the muscles that surround the pelvic organs that start to descend. So they become loosened and weak, and then the organs start to come down. And this can include various different organs. So it can be your vagina, it can be your cervix, your uterus, it can be the rectum, or the bladder, or the urethra. So it can be a combination of those different things too. Symptoms vary depending on the person, but common symptoms are just this sense of pressure in your pelvis, heaviness in your pelvis. Might feel like a tampon's falling out, or you have this bubble in your vagina. So it just feels different. Sometimes it's pain though. Sometimes you can get this vague low back pain or abdominal pain. Sometimes it can start after you maybe lifted something really heavy and you're suddenly feeling these symptoms. Sometimes people can get urinary symptoms too, where they're having leaking, like incontinence, or leaking of stool too. So that can often go hand in hand with the prolapse, but not always. Symptoms usually get worse after prolonged standing. So if you've been on your feet for a long time, maybe if you've lifted heavy things, if you're straining a lot, so maybe you're having a lot of coughing, or you're straining because you're constipated. All those things can really play a role in it. And there's a lot of things that can contribute to having a prolapse. So having babies is one. So either a vaginal delivery or a C-section, you can get a prolapse still from. Especially higher birth weight babies contributed to it more so. Other things that can contribute can be genetic. Sometimes it just kind of runs in families. Aging and some of those hormonal changes associated with menopause can contribute, as well as if you've been dealing with a lot of chronic pressure. So chronic cough, or like I mentioned before, if you're chronically constipated and you're always bearing down, that can definitely contribute as well too. So there are 4 different grades of a prolapse. So the first 2 respond really well to PT. The grades 3 and 4 are a little bit more severe. They can still do well with PT. Sometimes more intervention is needed too, but it's definitely a good place to start with PT. So what can we do about it? There's a lot of things we can do to help manage symptoms. A lot of it is just learning to manage pressure in your body better. So a lot of people bear down when they go to lift up for something, and if you're doing that repeatedly throughout the day, or even if you're walking, standing, and you're bearing down, where you're not managing that pressure well, it can just put a lot of pressure on those organs, and if those muscles around the organs are already weakened, you can imagine that that's going to put pressure downward, which will make your prolapse symptoms worse. So we always want to teach pressure management, how to manage pressure, how to breathe well, how to have that good, nice posture that's going to help with just regulating pressure and efficiency in your body. And then teaching you how to have good body mechanics with lifting, so you're not bearing down. Sometimes pelvic floor muscles can be weaker, maybe they're tighter, and so we want to address those differences too. So it's really individualized based on lots of different factors to look at, but we want to get you as strong as possible, get you moving well with your body efficiently, and get you breathing well, and all those different factors can respond really nicely. I find working with patients with prolapse really rewarding, because it's a really scary thing to come in and feel like your organs are falling out and feel like, oh my gosh, this is how it's going to be. But often after just 1 or 2 sessions, people start feeling so much better just by learning those little strategies. So I strongly recommend that if you're experiencing any of these symptoms, or if you're just wondering if could this be something I have maybe, that you reach out to us and give us a call or check us out for a free discovery consultation, and we can find out and see what we can have to offer for you. Otherwise, I hope you check out our website at www.balancewithinpt.com, and there's a lot of great resources and more information on prolapse in there as well. Thanks so much.